Welcome to North of 60. I'm Heidi Schweighofer. I haven't seen you all for quite a few months. I hope you had a great summer. Today my guest is Tracy Krauth. Tracy is a physical therapist with over 35 years of experience. She is working out of Western Reserve Hospital Rehab, which is in the natatorium in Cuyahoga Falls, so it's nice and close by. Tracy works in orthopedics and states that primarily the patients who come in to see her are over 60 for spinal issues. And so today we're going to talk about sciatica. Tracy, thank you so much for coming.
Thanks for having me.
All right, we're going to jump right into this. Sciatica, what is it and where does it come from?
Sciatica is a term that's used to describe pain, like a pain pattern that starts in the low back and travels down the leg, usually to the calf. So people can describe it in many different ways. Sometimes they describe it as tingling and numbness, sometimes it's sharp, sometimes it's dull. Just depends on how the individual, thinks about how it feels. But it got its name from the sciatic nerve.
Okay.
So the sciatic nerve is the biggest, longest nerve in the body, believe it or not.
I didn't know that.
Yeah. So when it gets irritated, it can create some issues. So the sciatic nerve comes out of the lumbar spine and travels down the leg. So when somebody says they have sciatica, it's following the pain pattern of that nerve.
Out of the lumbar spine, and so it goes this way and this way.
Yep, so you have two of them, one on the right,
Okay.
one on the left.
Okay. And it goes all the way down to, where does it end? In
It goes
the calf?
into the calf and then it splits.
Oh, for heaven's
So
sakes.
sometimes people can get some issues into their feet as well.
When I hear people talk about sciatica or sciatic pain, they always seem to sort of hit their rear end or right below their rear end. Is that where the pain is worse for most people, or is that because that's where it's coming out of the spine?
It honestly just depends. It's a human body, so our human body does funny things,
Yeah.
but it does depend on the source. So the sciatic nerve can get irritated in a lot of different places. Sometimes it can get irritated up in the lumbar spine, maybe from a disc issue or from a stenosis. But
Okay.
sometimes it can get irritated down in the hip area, like start there, maybe around the piriformis area. So
We'll talk about that
Yes.
whole piriformis thing.
yeah, but sometimes, it doesn't have to follow that exact pattern. Sometimes people have just spotty issues through their leg where they might feel a funny sensation. It can be nerve pain.
This is not on the, can it come and go?
It can come and go.
someone have it like 5 minutes and it goes away?
It can come and go, for sure. It's weird.
I wondered that. Sometimes, okay, well, I'll have to ask you after the show. But I've wondered if it can be, for an hour and then you don't feel it for 2 weeks.
Sometimes that happens.
Can you tell me what aggravates it? Why is it so over 60 generally? I hear so many complaints from my friends about it. Is it because we tend to have more spinal stenosis or arthritis in our lumbar spine, or is that nothing to do with it?
Yeah, so in the over 60 population, as we age, I'm going to hold up the spine for a minute.
Yeah, do.
So as we age, these discs that are in between the vertebral bodies on our spine, they lose their water. And so if they lose their water, these bones can get closer together. And then there's also joints on either side of the spine. And they have some cartilage in them, kind of like your knee joints have, a cushy cartilage. And as we age, sometimes the cartilage can deteriorate just from either postures that we've held, jobs that we've done, how we abuse our bodies. Over time we can kind of damage those areas. And so bone has a funny property. It was when bone rubs on bone, it creates bone. And so as we age, sometimes we get more bony
spurs. Is that what a bone
Yep.
spur? Yeah.
Bony spurs, and sometimes arthritis can form within the little canal in there, and then it can pinch these little nerves that are coming out and create pain.
So spinal stenosis is when these are gone or deteriorating and there's bone on bone and the bone may be creating bone.
And inside here too. inside the canal. That's where the spinal cord runs.
Okay. Well,
Where in the younger population,
Yeah.
I'd say younger, maybe, under 50, you might get more of an irritation, something like this that might happen where there's an irritation with the disc, like a bulging disc.
Is this a bulging disc? And what would cause that? Well, a million things, I'm
Yeah,
sure.
a lot of things, like most of the time it's postures that we hold during our day. So if you think about this being like a water balloon, and if I put a little pinhole in the water balloon and let me squish the front of it,
Yeah.
the water is going to come out the back.
Yeah.
So the same thing happens when we have postures that put us like in flexion or we bend.
Oh.
If you think about your day from the time you get out of bed, you bend and brush your teeth, you look at your phone, you drive to work. People have jobs that, you bend all the time or bend and twist or,
Right. Even
if-
making the bed, picking up the
Yep.
dog, doing cleaning.
tending to grandchildren,
Yeah.
gardening, everything you do is bending forward. And so that usually is what creates that mess. And if that gets big enough, it can hit that nerve.
So that's another reason people could have this.
Correct.
Tell me, I just love it when props come because it's so much easier to see things
yeah.
when instead of imagining it. So is it, are there other factors for, let's say 60 and over, but maybe not? Are there other factors? So one of them is spinal stenosis. What about obesity? What about lack of exercise or too much exercise? What about, I'm trying to think of anything else. Poor posture, sitting in a chair kind of slumped up while we're on the computer. So tell me how those things can affect this.
Well, being overweight definitely puts more pressure on the spine and can create some damage maybe a little bit early, make the spine age a little bit earlier than it should. And then, of course, postures, like I just said. I mean, our postures take us forward all the time, especially after we retire. Maybe we like to read a book more often. We're laying in bed or we have it in our lap or we're forward.
Yes.
Doing puzzles, things like that, where people are sitting rounded and forward.
On their laptops.
On the lap, yes.
I do mine at the kitchen table, and I notice myself kind of slumping over the old thing. All right.
Yep, so all that can add to some wear and tear.
Okay, now, treatment. All right, so now we're going to go over, we talked about why it's a little bit more common. I want to talk about, let's go on to that piriformis business. So I told you I had some low back issues, and someone's talked about the differentiation between sciatic nerve pain and piriformis syndrome. I know everybody's heard it, but I don't think any of us know what that means. So can you explain that? What is piriformis syndrome and how does it differ from what's going on with sciatica?
It's different and same kind of in the same sentence. So it's very different in the fact it's the source of the pain. So the piriformis muscle is a very small hip muscle. It's pear-shaped, and bring the spine back out, but it attaches kind of in here, which is the back part of like your sacral area.
Oh.
That's where it starts, and then it goes over to your hip. So it's a hip muscle. But it lies in your buttock. And the thing about the sciatic nerve is that it passes very much adjacent to the piriformis. So most of the time it goes under the piriformis, but sometimes there's an anomaly and it might go through it. And so people that might get an irritation of the piriformis are going to get sciatic-like symptoms, but it's not necessarily coming from the spine. So like guys, a lot of times that carry their wallet in their pocket, and they might sit a lot. Yeah, they can agitate that piriformis and create pain in that area.
So I guess I didn't even know it was a small muscle on both sides?
Both sides, yep.
And it's not the same. So how do you do a differentiation for that and sciatica?
Just a series of tests that we would do in the clinic. We have to pick a route to go, and if we do a back assessment and we're not finding anything, then we might move more towards a hip assessment and try to figure out where the problem's coming from.
Is that in younger people, or can it be any age?
I think it could be any age. It can be from prolonged sitting, like I said, with a wallet, or, a lot of people go and sit in bleachers. They watch their grandkids, at sporting events, things like that. Sometimes just repetition. So, I have some patients that they want to, start getting healthy. They start a walking program, so maybe they start out too fast. Maybe they start walking up a hill, or repetitive cycling. Can be a lot of different things that just might irritate that and then can create irritation on the nerve.
Well, gosh, maybe we should all be sitting around. No, I'm only,
No,
I'm
don't
only
do that.
kidding. No, I know. But people do that. Okay, now I am going to start walking 2 miles a day, and I'm going to do it starting today.
Yep.
And then something hurts, and you stop, and then, right. All right, let's go on to treatment, dear. We've talked, what happens if it's untreated, and then what are some of the treatments? Let's talk about what happens if it's untreated. So we're going to go back to sciatica. I decide I'm not going to treat it. It's going to go away. It doesn't go away, but it's a little better when I take Motrin or something, so I don't do anything about it. What are the worst things that could happen if it's just you don't pay attention to it?
I mean, sometimes it does go away, because sometimes it might be, caused by maybe you took a long car ride, maybe you slept in a bed on vacation, maybe you irritated something like that, and it's just an irritation and it'll go away. But
let's say it doesn't after a month.
Then you can run into trouble, because if there's something pinching that nerve, if I close my finger in a door and leave it there for a while, I'm going to lose my finger, right? So if there's pressure on that nerve, it's going to continually get irritated, and it can create some big problems as far as different pain into the leg or trouble walking, and really affect somebody's lifestyle.
Can is numbness one of the symptoms of that?
It can be.
So you can't feel your feet, perhaps? And couldn't that lead to falling?
Lead to falling, a trip and a fall, for sure.
Oh my gosh. All right. I want to talk about treatment. So let's say I'm not going to go. What do I do first? Do I see my doctor and say, I have this pain? Step 2.
Step 2, after the doctor?
I go to my family doctor and I say, boy, this has been hurting me now, and it's going down my leg, and I don't know, I can't stand it anymore. And she says, okay, well, I'm going to have you see somebody. So do I see an orthopedic guy or woman, or do I see physical therapy, or does it depend, Tracy?
It does depend. It depends on the severity of the symptoms, on which direction they might direct you.
Okay.
Most people will get an x-ray just to rule out the big things, a fracture or something like that.
All right.
And insurance dictates a lot also of what we can do, and which treatment path we need to take. But most of the time we do get a referral, before they might go the orthopedic route.
Okay, so insurance, Medicare would allow me to see you directly?
Correct.
Oh, good.
Yep.
Good.
For sure. And then they would come into our clinic, and we would do an assessment. We'd look at how they move, we'd look at their strength, look at the postures, talk to them a lot about their lifestyles, and then try to figure out a treatment plan that is going to get them back where they want to go.
How long does this assessment process take?
The initial assessment in the clinic is generally about an hour.
And by the end of that hour, you are able to discern, okay, this is what we think we're going to try, as long as the patient is willing to do that.
Correct.
Okay. Then what happens? Then you start physical therapy, or do you say, well, maybe you need a steroid injection, or maybe you should be using ice or heat at home?
Yes, we'll tell them, heat or ice. Usually, we usually recommend ice. We like that ice to shut down the inflammatory process in situations like this. But we usually give them something to work on at home, day one. And in the case of the spine, we talk to them a lot about postures and lifestyles, and how they're going to take responsibility a lot of times for things that they're doing that might be creating that. And then we would, depending on what we see in the clinic, we might set up, once a week, twice a week for a couple weeks, just to, get on an exercise program so we can get them stronger and back into their daily lives.
So with the lifestyle changes, What are you recommending to people? If I came in again and saw you and now the assessment is done, we're ready to start, you're teaching me exercises and talking to me about things I can do at home, what are you suggesting I do at home?
Well, in most situations, we start a lot with posture.
So what are you saying people should sit up? Tell me about posture, Tracy. I mean, we all are told sit up straight.
Sit up straight, right. So if you don't sit up straight and you constantly, again, push, if we round out our spines and we push that thing, closed here in the front, we can create something like that. So in somebody that might have something like this going on, we would talk to them a lot about posture. Maybe using a lumbar roll, something like this.
Where, on a chair?
That would go behind you in your low back, and that helps sit us up straight. Because sometimes we might think we're sitting up straight,
I know.
but we're really not sitting up straight.
Sometimes we only think straightening our shoulders means we're sitting up straight, but we're slumping down there.
Right.
Yeah.
Right. But sometimes in somebody that might have stenosis, we want to be careful because sometimes they do better when they are rounded, because that opens up that space in the spine and takes the pressure off that nerve. So that's part of our assessment in the clinic, is trying to figure out where the pain's coming from and then be able to direct them in the right way.
So if they have stenosis and will you tell them to go ahead and slump, or do you tell them kind of straighten her up but don't,
I mean, not usually, but some people just don't do well with the roll behind them. And so I wouldn't necessarily tell them to slump, but maybe they don't necessarily need to sit with one of those.
Oh, okay.
But certainly, again, going back to the puzzles or the reading, or their daily postures are going to affect how they feel.
Tracy, it seems like all of us just start curling down. I mean, honestly, I think I'm sitting up straight, and then I'll see myself and I think, oh, where did I get this head thing? This lump not lump, but the back of my neck curves. Or that's so hard to remember posture all the time.
It is. It's a battle. It's a constant battle. But we do a lot of strengthening in the clinics. We'll work on postural muscle strengthening. And so I don't know that it necessarily solves the problem that we won't ever slump, but it gives us a better posture, and core to help us sit up without having to think about it so much.
One of the classes that we were thinking of doing in 2025 in the senior group is a sitting core strengthening class. It's all done on chair. Everyone talks core. Is that a very major component of this? Sciatic pain, getting rid of it, going forward? Core strength being very important.
Mm-hmm. It's the stability component of our spine. But what most people don't understand is core is more than just doing a sit-up. Your core is also involves a lot of our hips. So we do a lot of hip strengthening in the clinic because that's the supporting structure for how we move. So we work a lot on people stabilizing their core while they're moving their arms or moving their legs, because that's how we function during your day. So your core is not just, your abdominals, it's also your glutes, your hip muscles.
Oh, the whole kind of midsection.
The whole midsection.
Okay, so now they're doing exercises, they're getting better. What can make it worse again? Of course, we've talked about some of the things. What about sleeping? Is there a way to sleep at night with this that's better or worse? Does that make sense?
Sleeping's tough.
Yeah.
Depends on the mattress. We usually talk to people about trying to stay in neutral, which of course we move around when we sleep, but a lot of people like to sleep on their side, so we encourage them to get a pillow between their legs.
Why? I hear that a lot.
Because if you don't, then your top leg is going to roll over your bottom leg, and then that's going to twist your spine when you're sleeping.
Oh, I never thought of that. So if there's a pillow in between, then you're going to be lying pretty straight.
Right, in neutral, like you would be in standing, and just flip you on your side.
Okay.
If you think about it, if I take my finger and I do this, if I even keep it here for an hour, it's going to be stiff, right? When I bring it back, the same thing happens to our spines when we sleep. We're usually in bed more than an hour, but even if we sleep in that awkward position for an hour, we're going to be stiff when we go to move.
Yep. Is there a position that's better than others? I know that I keep reading, don't lie on your tummy, or don't lie directly on your back, or don't use two pillows. You know, should we have something under our necks? Tell me what you would recommend for older people with or without sciatica.
I mean, the neck is the same concept. You want to try to keep your neck in neutral. So sometimes we can roll up a towel and put it in the pillowcase to help fill the void that's in here, if that makes sense. So when you lay on your back.
So our head's on the pillow, but the roll is right under our neck.
So that way, maybe when you roll on your side, then you have the space instead of, if you have 2 or 3 pillows, then you're sleeping, you know, like that the whole time.
With your head crooked. And 2, I always seem to have pillows that smish down to nothing. And then I'm not getting any support that way either. So you're recommending like this?
Yes, it would just be longer and probably a little bit thinner.
And put this underneath your neck in a pillowcase.
You could.
Okay, that's one idea.
That would be an option. That's a homemade lumbar roll, by the way.
And so this, instead of buying one, I could stick this, it's just a towel.
It's just a towel. Yep, use it in the car, wherever you sit. Stay off the couch.
Do you like the thought, do steroid injections work?
For some
people.
You don't.
I know you don't give them. I hear people say, well, I need to go in and get a shot.
Yeah, I think like anything, there's a time and place for those.
Okay.
Yeah, so it's just, some people yes, some people no.
Do you think that physical therapy can work equal to or better than a steroid injection?
I think they can work in conjunction with.
Okay.
Yeah, because a lot of times that will decrease the inflammation or decrease the pain, and then allow the patient to proceed with any of the therapy exercises, because sometimes the pain gets in the way. You know, of them doing their
anything.
Yeah.
I had a friend who could barely, honest to God, couldn't put her foot up one step, and then stopped all her exercise classes and walking and everything because it was so painful.
Yeah.
And I felt so badly for her, and I thought, you know, you got to do something.
Yeah, become debilitating.
It very much, and it just kind of snowballs then. Well, I can't do it today, so no, I'm not going to try next week because it might come back. And
right.
Do you think people should see you? Should people see their doctor to see you with early onset of sciatic pain, if that doesn't sound too stupid? Like maybe not immediately, day one, but if things are not progressing better and they're starting to find themselves limiting their walking around and going up steps, then they should see you earlier rather than wait till it's numb feet.
Yes, because the longer they wait, the harder it is to get it to go away. And one thing I always ask my patients is if they've looked at anything on Dr. Google, you know, they Google things to do, and it's not necessarily the right thing to do. You know, depends on what we find in the clinic, which direction they need to move.
I have to ask you specifically about some exercises that I read you should never do or you should do or something. Now, hang on. Hamstring stretches, I've heard we should always avoid, and we should avoid any exercises that require bending over and like touching your toes from a standing position, and not stretching your hamstrings, which I didn't know was a bad thing. What is correct and what isn't?
Well, again, it depends on the situation. It's just a hard question to ask. I mean, or to answer. Hamstring stretches aren't bad, but it just depends on if it's something, it might not be the right time and place for them. You know, maybe we need to go through a series of beginning exercises before we would move on to the hamstring stretches. But the forward bending, for sure. If I go back to this, right?
Yep.
So every time we forward bend, you know, people get out of bed and they repeatedly want to touch their toes, right? Because that's a goal, because everybody wants to touch their toes. And so we just keep creating that. You know, think about a paper clip. If I bend a paper clip and I bend it 99 times,
it's going to break.
And then the 100th time it broke, it wasn't that 100th time. It was all the times we bent
Tracy,
before.
you know, I just Okay, I'm going to just say this, and then I'm going to ask you to summarize a minute. There's this exercise program that plays in Japan, and it's 5 minutes of elderly people doing 5 minutes of things when they first wake up in the morning. And it's windmills and touching your toes and jumping. And I thought, maybe that's a good idea. But then I think, right when I get up, I'm not sure if my body's limber enough at that point to be able to do the toe touching and the windmills and the jumping jacks. I think people do think they're doing the right thing.
It's always good, I think, to get your body warmed up before you do any kind of exercise program.
Especially touching our toes.
Bending.
Yeah, all right. Now, if you had a chance to say one summary kind of comment to our over 60 group about sciatica, what would you say? Or 2 or 3 comments.
I would say watch your postures, just be mindful of them during the day, and stay moving. Just keep moving.
And don't let yourself just sit there looking at your laptop or your phone.
Yeah.
My God, our phones.
And don't let something go unnoticed. If you start having symptoms, then get them looked at.
Do you think people should automatically go out and start looking at lumbar pillows and so on, or should they wait to see somebody first and then learn what they need and what they don't in terms of equipment?
Yeah, I mean, I think in most cases sitting with something is a good idea. Just that it does help our postures, but I would say if somebody puts something behind them and it creates a set of symptoms, then maybe that's not the right thing for them.
Okay. All right. Tracy, thank you. Do you realize how quickly this time went?
No, I don't.
I know. Thank you so much for watching. I hope you learned as much as I did. Tracy's information is going to be given to you at the end of the show, and I don't know if you need to you can directly contact Tracy or whether you need to go through your doctor. Do you know that, Tracy?
You have to go through the doctor.
Go through your doctor, and then your doctor can refer you to her. Correct. And hopefully you'll find some relief. Thank you so much for watching. Bye-bye.